Hi, Mary. Welcome to the Your Dose
Hi.
podcast.
Hi, I'm so excited.
I'm so excited
Good
for
to
you to
meet
be
you
here.
finally.
I know, yeah. Honestly,
Mhm.
this has took me and Mary probably about 3 attempts, I think.
I
About.
think so. I think so.
Yeah.
It's
And then I was delayed in traffic this morning, so I didn't think I was gonna make it. But anyway, we're here. Whereabouts in the world are you, Mary?
I'm in Nashville, Tennessee, the US. Yeah, so pretty
And
far.
very far. What time is
hmm
it where you are in the world?
It is about 5:30 p.m. Yeah, it's like a big
And it's
difference.
very different because it's 8:30 here in the morning, so I always find
Woo!
this crazy. So you're ending your day and I'm starting my day.
Right.
So tell us a little bit about Mary. What is it that you
Mhm.
do for work, and what are some of the things that you enjoy doing outside of work as well, because that's equally very important.
Yeah. So I am a master's level therapist. I'm practicing under supervision right now. My background is with OCD, anxiety, and related disorders. I've been working um, with them since about 2021. I did grad school online so that I could work full time. And so I was really lucky to be able to get really, really great training and experience in treating OCD before I had even gone out and started doing individual therapy because I worked with Rogers Behavioral Health. So professionally right now I'm doing just regular outpatient individual work for people with OCD, um, mostly treating adults right now, some teenagers, but we've kind of moved past working with the kiddos. I used to work with them quite a bit, but so that's what I'm doing right now. And I love it so much. In terms of things that I do outside of that, I like to paint and I do a lot of weightlifting. I'm a
Nice.
mental health advocate for a um, a trainer in the UK, so I'm actually used to this time difference meeting situation because I'm
Oh,
the on a team for a one-to-one coaching program with someone who works out of London. So this is
oh,
like the trials and tribulations of timing. I'm
yeah,
no stranger to those.
yeah.
Um,
Wow.
so I'm really, really passionate about, obviously OCD is my main thing, but I'm also really passionate about kind of the fitness industry and mental health and sports and how um, anxiety, OCD, body image, body focused issues that people deal with, like in that area too. So I advocate a lot there. And then I just really like cats. That would be my other thing, cats,
Yeah.
reading.
See, I'm a dog person, but
It's okay.
I'm
It's okay.
fond. I'm still becoming more and more fond of cats. Um,
Mm.
they used to dislike me a lot,
Oh no,
but then I think cats can like recognize and sense energy,
they
and I think
can.
maybe because I'd had so much like negative energy inside of me, they were like,
Oh,
"Get away! Don't want to be near you." Interestingly, after I've done work on myself, cats
wow.
don't seem
Interesting.
to be
Huh.
as aggressive is probably the word.
Aggressive. I've never been attacked.
Yeah,
Like,
I've
were
been
they
attacked.
aggressive with you?
Yeah, like
Okay. Well, I
literally,
can.
what was it? It was a really old boyfriend, and I
Mm,
stayed over, and the cat would just like launch at me and just like dig its
ooh.
claws into me. And then I woke up in the middle of the night,
Mm-mm.
and the cat was literally like on top of me, digging into me. It was very
Oh my
traumatic.
goodness.
Yeah, it was quite
Yeah. No.
traumatic.
I mean, I'd probably be a dog person too if that
Yeah.
if that had been my
But look,
experience.
I'm open to cats. Before I was
There we
very
go.
no, but I'm more open to cats
You're
now.
getting there. Yeah.
Yeah, exactly.
They're the best. They're the best.
So I'm intrigued about your passion for therapy and mental
hmm
health.
Yeah.
Um, my passion for psychology and studying it came from my own personal experiences, and you often
Right.
find that. So, was that the case with you, or?
Yeah. Yeah. Sure. So I've always been interested in psychology, but I think the personal experience bit is what really kind of makes me as driven as I am, just because if you've experienced something, the advocacy piece, there's even more of a weight to it because you've lived it. And you continue to live it too. I think a lot of people, therapists who have lived experience, my technical difficulties. Okay, there we go.
Don't worry.
Therapists who have lived experience, like there are going to be times when they still have symptoms kind of pop in and kind of get onto them a little bit. And so I think for me, being able to use that with advocacy and use that even like in sessions with clients, like as like examples, pulling from your own experience
Yeah,
can
that's
help make it,
amazing.
yeah, it can help make it, it makes things a little bit more trusting, and it can help, when people really, really feel like, oh, you literally know exactly where I'm coming from with this, I think that it helps make an environment that is like completely non-judgmental, because a lot of these thoughts that people come to therapists with when they're struggling with OCD are really taboo, and there's a lot of shame. That it's really unfortunate that it's there, but it's there. There's a lot of shame, and so having experienced a lot of these thoughts and obsessions myself, particularly with OCD, I find it really helpful for people if I'm outspoken about it. And that's kind of what helps me continue to pull from that and give people resources, because it's like, oh, there's an intrusive thought, gotta post for that one, right? Like I can just kind of put out, this is what I did today. And that's really
Which I think is
helpful for.
amazing. I mean,
Mhm.
obviously, there's a place for people who are therapists and never experienced mental health, and they
Oh,
have
yeah,
their
absolutely.
benefits being a
Hmm.
therapist and never having experienced mental health
Yeah,
issues. Um,
absolutely.
but then also I think there's so many benefits from someone like yourself who's actually
Mm,
lived it. You can sit there and really empathize with your clients and well patients, and yeah, draw your own
mm,
experience as well to help them as much as you possibly can, which is amazing really. um
mm,
so OCD is something that you've struggled with
hmm.
in the past, still struggle with
Yeah,
now.
yeah.
What exactly was the journey? When did you first realize you had OCD?
I think I honestly realized that it was OCD a few years ago. I am primarily mental rituals. For me, that's my compulsions. I'd say like 90% of them were always mental. And so
Yeah.
realizing, oh, that's what's going on, because a lot of people, right, they think, oh, I'm just really anxious, I have anxiety, I'm just worrying all the time, and really that's not
Yeah.
what's happening. You're compulsing
Yeah.
out the wazoo is kind of what was going on for me. And so I kind of realized that that's what was happening with me a couple of years back. And since then, it's interesting and it's unfortunate that this doesn't,
Oh,
so I think for me, like figuring that out, the insight was so helpful, because then I was able to kind of connect dots from when
yeah.
I was like all the way back to when I was little bitty. Because the
Yeah.
things that I did, it was like, that's a little odd. Like,
Yeah.
that's quirky. I was pretty anxious. I was pretty, my mom would always tell me, I grew up and I always had this, it's gonna hurt mentality whenever there was like anything new introduced, because I wasn't sure, like I didn't trust it. There was so much doubt about every single thing. I threw a fit when she was trying to get me to try like French fries for the first time. And I was so worried that it was going to be a negative experience that I was like, not trying it. So that was like my entire life. Anytime I perceived any kind of potential threat, I would avoid. But then, like little things, like if I don't run up the stairs fast enough, something bad's going to happen. Or if I potentially tell a lie, that's the end of the world. So I'm going to confess every single thing all the time. Like little things like that, looking back on it now,
Yeah.
I have moments of, huh, interesting, like having like intrusive thoughts, having these fears that were not generalized, anxious day to day fears. They were very, very clearly obsessions. Looking back on it now is really freeing, because I can really kind of understand what was going on for me. And that helps me give myself compassion for my little self back then. Right.
Oh my
Yeah.
gosh, I resonated with that so much. Like everything that you said, I resonated with.
Mm,
And I've spoke about this a few times on here, but this
yeah.
podcast and hosting this podcast has literally been therapy for me. And
Oh, I love it.
it has helped me real understand myself more than ever, and especially
Mm-hmm.
my younger self as well. And looking back at some of the patterns that other people have had as a child, and things that were like quirks, and I was just
Mm-hmm.
always just a little bit different, and I always felt a little bit
Yeah.
different. And now I realized that it was OCD, um,
Right. Right.
definitely OCD, and I would I have benefited from knowing that as a child? Probably not.
Mm-hmm.
But would I have had the treatment that I probably needed from a younger age?
Yeah.
Yes. And
Yeah.
so, and that's why these conversations are so important, to help people
Mm-hmm.
realize what it is that they're experiencing. And
Right.
even if it's like a parent that's listening to this, to trying to understand their own child, um, they're able to go and get that early intervention, which obviously is so important before
Yeah.
things start to spiral and get worse. And comorbid disorders are really common with OCD as
They
well.
are.
Um, but in terms of OCD themes,
Yeah.
you have mentioned on your page, your Instagram page, about Harm OCD,
Harm
and this is
OCD.
one,
Yeah.
yeah, this is one of the like taboo themes which I've touched on
Right.
with that throughout my podcast. POC being the biggest one so far, that I think has the
Mm-hmm.
most stigmatization around it.
Sure.
But
Yeah.
harm OCD is still a stigmatized
It is.
theme.
Yeah.
Um, would you mind sharing your experience with harm OCD, and when you
Sure.
first, if you can remember the first time that you kind of experienced that theme?
Yeah. So I don't have a specific, like, this is how old I was. I think, like, for me, obviously with OCD, like, themes can jump around
Oh
all the
yeah.
time, which I'm sure you understand.
Oh
It's like
yeah.
all of a sudden I'm worried that I'm, you know, I had one the other day where I was working out. I have a gym under my house, and under my house, it's like my lower floor. And I thought I saw something. I'm like, oh my gosh, what if there's a murder right there? And then there wasn't anything there. And then, oh my gosh, what if I'm schizophrenic? Just boom, boom. So my
Honestly, I just
themes
love these
have.
conversations because I'm like, I am not a weirdo. Like, I
Oh
do this
no,
all the
no.
time.
Oh
Like,
yeah,
all the
absolutely.
time.
Yeah, and I'm able
Anyway,
to luckily now be like, that was weird. Okay, thanks,
yeah.
brain. I'm
Yeah,
busy. But
literally. Yeah.
previously,
Yeah.
it's like, what does it mean? But I think like the first memory that I have, mine was always with harm OCD, and it's kind of changed a little bit over the years. But initially, it was more like if I was unloading the dishwasher, and I was like putting knives away, and I had a family member walk past me, I'd have like an intrusive thought of, oh my gosh, what if I stab my family member? Right. And it just made me so, it's not great. It's not a great
Yeah.
feeling to have. And again, like, I say again, like I mentioned this already, but with harm OCD, it doesn't have to be violent. I think a lot of people automatically go to the violence, but it can also be harm as in like hurting someone's feelings, like
Okay.
causing emotional harm. Like there are a lot of different things that can come up. But again, with in terms of taboo, these violent thoughts can get really just on like gruesome and horrible. And for me, that was my first one was, like you have these like massive kitchen knives you're putting away. And I think I was probably, I don't know, I want to say I was probably around like 17 when I first had an
Wow.
intrusive thought like that. And it was, for me, I think oddly, I was confused. And I think I just felt kind of like gross. And weirdly, it started to bug me more and more the older I got. And I think that's probably because I've also experienced scrupulosity. So when you have scrupulosity OCD and harm OCD, it's like, what if I'm a bad person? What if I'm breaking rules? What if I do something wrong? And then you're having these violent, horrible images just pop into your head. It is kind of really a recipe for disaster. And so now I still get the ones, mine has changed a little bit, and it's more towards like my pets. So I have this puppy, and it's like, what if you stomp on his head?
Oh my gosh.
Or what if you slam my, again with the gym, his name's Hobbs. He's a guest star on my Instagram quite frequently, but we have these windows, and he's an indoor outdoor cat. He's always been that way. We found him when he was a stray. So we let him do both, but he likes to come up to the window and climb in and sit with me while I work out, come and go as he pleases. But I have this really recurrent intrusive thought where I'm like letting him in through the window, and it's like, what if you just like slam the window down on him? Horrible, right? Scary. I'm like feeling, we use this, the
Yeah.
scale for anxiety I learned at Rogers is 0 to 7 and not 0 to 10, because a lot of times you'll find people with OCD anxiety, they're just going to pick 5, right? So if I look at like the 0 to 7, thinking about that intrusive thought now, I'm probably at a solid like 3. Um, right? And it still gives me that feeling. And so what I want to do in those moments is like back away, right? Like I'm not, not going to touch him. I'm freezing. The window needs to be closed, but he's too close to the window. I'm not going to close the window.
Yeah,
Like that's what kind of that avoidance urge
exactly.
for me comes in. And so that's kind of like the one that's been the most repetitive for me recently, but it all started with the dishwasher.
Yeah.
Um, so I try to be very open about that one specifically, just because I think with Harm OCD, it's so isolating, I think. And I think that's because of like some of the stigma. I've had people kind of DM me and say like, I'm dealing with this. I feel like I'm a horrible person. I feel so alone, because you're worried about what will happen if you speak up, right? Like there are people, I had someone tell me that they told their therapist at college about their intrusive thoughts and they got kicked out of their dorm, because people were worried they were a threat, right? And so there's all this like misunderstanding and stigma. I get people commenting like, you're a horrible person, this is disgusting, why are you having thoughts like this, gross. And I shut that down quick, because it doesn't hurt my feelings anymore, but it's very harmful.
For the people who do
um
follow your page, who are
right,
maybe on
right.
the start of their journey with Harm
Mm-hmm.
OCD,
Yeah.
and maybe they follow. I think there's a lot of followers on these mental health pages that kind of just sit in the back. They might not like
Mm-hmm.
anything, they might not
Yeah.
interact or engage with you, but they're
Right.
looking, they're listening, and they're
Yep.
uh, maybe using you as like a starting point for them to eventually
Mm-hmm.
go and seek support. And like you
Yeah.
said,
Yeah.
if they're reading comments that are saying, you're this, you're that, you're awful person. I see it all the time,
Yep.
on these mental health pages. It's disgusting,
Yep. Mm-hmm.
but it's amazing and so brave that you're able to speak out about it, because whether or not people like to hear it, they need to,
Mm-hmm.
because it's normal. And
Yep.
so many people experience this, probably more than we'll ever know statistically, because people
Oh
won't
yeah.
come out and talk about it.
Mm-hmm.
So in terms of Harm OCD, how do you think that has affected your, if it has, relationships, work, and daily functioning at particular
Mm.
times when these themes have been more apparent?
Yeah. So I think that for me, I've always been, again, like such so mental compulsions. So I haven't ever, a lot of times with people with Harm OCD, like I've even seen people go as far to like anything that has a corner in their house, they'll cover up with something. So like the corner of a table, they'll put something over it so that there's nothing like sharp or a hard edge. Like they'll go that far. For me, it's just it ends up being a lot of like mental checking, internal distress. And I think that I'm lucky in the sense that the Harm OCD for me surfaced once I had more information about it. I think when I was younger, I felt gross. I never really told anyone about the thoughts when I was younger. I felt it was mostly internal feelings towards myself. Like, for example, if I was babysitting and I had an intrusive thought about hurting a baby or a child, right? For me, I think that it mostly affected me internally, because there's that shame piece of this person is trusting me with their child and this is what is happening in my head.
Mm.
Like, horrible, right? But I was like, but I need to make money, right? So I have to, I can't just stop babysitting. At the time, that was like my option. So I think for me, it really had a lot to do with just internal negative self-talk. Like, I am scum of the earth. This is nasty. This is horrible. Like, who thinks like this? Now it doesn't affect me as much simply because I have knowledge and tools, and I've healed from that. But I remember feeling like a fraud, I think, is the biggest thing. And it is more internal, and I was lucky that it didn't impair me more than just this internal pain. But I think with harm, again, like a lot of times you'll see with harm's OCD, the people who are having these thoughts are often the gentlest people. Because again, that the way that OCD is ego dystonic, right? It goes against what someone values. So if someone comes in and they have a raging harm OCD, odds are they're going to be like, yeah, I really value kindness. I value taking care of
Mm.
people. I value helping. I value love and relationship and all these things. So I think for me, it's like I valued all of that, and that I am sitting there feeling like I loved taking care of kids, and that was something that was really just lovely and important to me when I was younger. I loved it. And so to have that, and then to have those thoughts come in specifically when I was babysitting, like I think it was just this feeling of like, what I say is important to me, it's like not real. What if it's not real? What if that's not actually important to me because I'm having these thoughts?
Mm.
I hope that makes sense.
No, it makes
It was
complete
more internal.
sense. Yeah,
Yeah.
it makes complete
Mm-hmm.
sense. And one thing that's echoed throughout all of my podcasts when it comes to OCD, and something that I've really sort of emphasized in the POCD, same for this one, is that
Mm-hmm.
OCD, where no matter what theme it is, it's the same process. And you
Oh
obviously
yeah.
you're a therapist, you're a specialized therapist in this, but it attacks the things that you value. And I always
Mm-hmm.
compare this to my health OCD, because
Ooh, yeah.
that's been my theme. And I always thought it was health anxiety. Now it is actually class. It's no longer health anxiety. It is actually health OCD. Don't know if it's completely changed yet, but they are saying
Mm.
it's a subset of OCD rather than
Oh,
anxiety.
yeah.
But I care about my health. I care about being
Right.
alive, and I care about,
Mm-hmm.
yeah, just living. And
Yeah.
I don't value death. But
Yeah.
that's exactly what my OCD latches onto. It also latches
Right.
onto my relationships and the people that I care
Mm.
about most. And it's funny that you mention about the themes that you're having recently. And I definitely have times where it will just be one theme for like a month, like for that month. And then it'll
Mm-hmm.
move on, like in terms of like, so
Yep.
this month has been relationship. And I've just been so all consumed with the closest people around me,
Right.
and thinking about everything that I've said, everything that I've done. And
Mm.
like,
Yeah.
um, and that's because I value my friendships, because I
Right.
value being a good person and being a good friend. And the fact that I might not be that scares me.
Right.
And so my brain tells me that I'm not. So
Mm.
it's
Mm-hmm.
been an interesting journey for me to use my own experience to understand things like harm OCD, which is
Yeah.
something I've never personally experienced, but I just get it. Like I 100% get it
Yeah.
because of the other themes I've had. Um, but I do want to go back to something that you mentioned at the start. So you said that harm OCD is typically seen as like a violent form of OCD, where
Mm-hmm.
people are thinking,
Mm-hmm.
what if I kill someone with this, stab my mom with
Right.
this knife, or what, whatever it might be.
Mm-hmm.
But then you said it could be more internal, about harming others, from
It
like
could be,
a
yeah, emotional harm.
emotional harm. So would you
Yeah.
mind explaining what that might look like? Because I've not heard too much about that.
Well, I mean, when you think about kind of like, say you value your relationships, right? Like there's the what if I hurt someone's feelings through the fear of what if someone doesn't like me? But then any kind of causing harm to
That's
another
really
person
interesting.
would be extremely aversive to someone who wants to care for others, right? And so for me, that kind of looks like, what if I blurted like something just horrible to someone? Like I'm talking to someone, I know what they're insecure about because I care and I listen, right? If I'm talking to a friend, and my OCD will be like, hey, what if you made a really horrible comment about that and you triggered like something horrible for them? because you said something really hurtful? What if you intentionally said something hurtful? What if you liked saying something hurtful? What if that's what you want to do? Maybe you want to do it. I don't know. Right. And so, like, thinking about the repercussions, like the mental repercussions for that person of that harm that I may or may not impose by saying something hurtful falls into that category, just because, again, like, harm, I mean, we all know this, like, psychological harm is very, very real. When you talk about abuse, there are categories of abuse, right? There's physical abuse, sexual abuse, but there's also mental, verbal, emotional abuse, right? And so if you're concerned about harming someone, it can very easily be more about harming emotionally. Like, what if I manipulate? What if I'm
Yeah.
manipulative? What if I'm abusive and I don't know it? Right? Like, all of these different themes. And ultimately, like, it's all about how our brain handles doubt. Like, it
Yeah.
all goes back to that. Like, your subtype OCD latches onto these different themes and latches onto what you value, because that's where you're least likely to be able to tolerate doubt. So if OCD is the doubt disorder, it's going to latch on to all of those things. And so, like, if I value kindness, I want to take care of people. I want, not necessarily I want people to like me, but I want them to feel safe with me. I'm going to be this tolerant of the potential that I am causing harm to people in any way. It doesn't
Yeah.
have to be with my kitchen knife I'm loading up or anything like that. It can be with my words
Yeah.
too.
That's really interesting.
Mm-hmm.
And when you first started having these thoughts of harm OCD at 17,
Mm-hmm.
how long did it take for you to realize that this was a problem? And like,
A problem.
how did you seek help if you hadn't prior to this?
So, in terms of OCD, I was a self-helper. I think that because I realized it so late. I've been in therapy for other things, like when we talk
Okay.
about, like, trauma, right? Don't get me started on the trauma OCD pairing. Things get real messy there. But I was someone who, like, I'm going to do my research. I luckily know a lot of therapists just in my personal life. And so obviously they weren't giving me therapy, but I was like, tell me about this OCD thing. And I was like,
Yeah.
okay, check, 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 check. Obviously I have a diagnosis now, but I think a lot of it came from doing the nitty gritty work myself, and then having people in my life hold me accountable for my recovery.
Mm.
Um, I'm really, really close with my mom, and she knows a lot about OCD. And um, there are times still where I'll text her, or I'll be on the phone with her, and she's like, "Hey, you're literally using me to ruminate out loud right now. Cut it out." And I think that I
Yeah.
realized that it was a problem probably a couple years ago, when my mental rituals were just so loud. And since then, it's like, okay, I joke with my clients about this. I kind of did research, and then I ERP'd myself, um, because I think I got kind of fed up with it. And so I did, just kind of seeking out what I avoided. There was a period of time where I had banned behaviors on my phone that I'd be marking my bans on my own. Like, there's a submit to reassurance seeking. Oh, I resisted rumination. So, like, I was doing stuff like that for a while, and
Mm.
I've experienced relapses and symptoms, but yeah, I don't know if that's a good answer to the question, but it's kind of a really weird
Yeah.
journey for me, because a lot of it was self discovery, and then aggressively pushing myself towards, like, actively making brave choices. Um, and I think it's been good.
Yeah. I mean, you're here
Yeah,
and you're now an
I
OCD
am.
therapist helping other
I
people.
am.
So it
It
clearly
worked.
worked.
It worked.
Um, just quickly on the mental compulsions, you said they were
Mm-hmm.
so loud. You've kind
Mm-hmm.
of briefly touched on that, but what might a
Mm-hmm.
mental compulsion look like? Because we often talk about these physical compulsions of, like you said,
Mm-hmm.
don't covering the side of a table, and you've kind of
Mm-hmm.
briefly mentioned it. I guess it might be a bit personal to
Sure.
mention exact
Oh, you
examples, but
paused.
sorry, it might be personal
You're
to mention
back.
exact. Sorry, yeah,
You're
exact
back. You
examples.
paused.
Oh, can you hear me again?
Now I can hear you. I
Yeah.
think I heard you ask about personal examples for like mental compulsions with harm
Yeah, no, I'm
OCD.
just intrigued.
Yeah.
What an example? If you have an example of that,
Yeah.
yeah.
Yeah. Mental compulsions with, I mean, again, anything can turn into a compulsion, but it can be like, oh no, I would never do that. So reassuring myself. It could be, um, and this may be like sort of some rituals are so subtle that they feel mental, but intentionally not looking at something that would trigger an intrusive thought. So that would be kind of avoidance is
Mm,
considered pretty mental. There would be mental reviewing. So I would, if I had like an intrusive thought, did you do this thing and not remember? Thinking back to 10 minutes ago, like, well, no, because then I put the knife back here and I can remember right now that like I did not do that. That kind of thing, mental replaying of situations, lots of mental replaying of like conversations, making sure that I didn't say anything super harmful or offensive towards someone.
yeah.
Um, so getting a feeling of, oh no, maybe I hurt that person. Let me sit down and replay this entire 20-minute conversation to look for something that I may have said that could have hurt them. Mental review. It's just, there's so many different
Yeah,
things.
I
And so your brain's doing, it's like a hamster wheel that's on fire is kind of how it feels or felt for me in my brain. Cause it's like, I'm constantly checking. And I had a lot of different subtypes happening at once, which was special for me. But for that, a lot of it has to do with like replaying situations in my head, making sure I didn't do anything.
yeah, no, it's quite interesting because um I guess an example that I have that's kind of similar would be
Mm-hmm.
if I thought that I'd said something or to offend a friend, or maybe like
Yeah.
there'd been an issue with a friend, and then what I would do is I'd
Mm-hmm.
go, especially after if I'd had alcohol and I'd forgot, and then
Mm-hmm.
I didn't hear from the friend for a few days, or maybe not
Mm-hmm.
even, maybe the next day, I then spend the day wondering what I did, and
Right.
then to check that everything's okay, I'd message, and then I'd check
So
what their
reassurance. Yeah.
response was and how they responded and what their tone was like, and then
Ooh.
I'd spend the
Mm-hmm.
next 5 minutes thinking, they seem off. That text isn't how they'd usually text. And then
Mm-hmm.
do this hop. I must have done something wrong. And then continue to do
Right.
things to try and like figure out how my friend is
Mm.
feeling. You know, it's
Right.
so I get it. And so
Yeah.
that's like I didn't realize that would be a mental compulsion, but that makes a
Oh
lot of
yeah.
sense.
Big time. Big time. I
Yeah.
think I think a lot of people, and that's why it's so important to understand like the ins and outs of your mental compulsions, because a lot of times people, they can be so sneaky. Like with reassurance seeking, people will be engaging in a conversation and I will wait to see if you say a specific thing, or I'll wait and look for a specific facial expression. I always joke it's kind of like you say something and then you're like, okay. You say something and then you wait and see how the person reacts. Like that's a real sneaky sign of kind of reassurance seeking. There are so
Yeah.
many different ways that mental compulsions can kind of weasel their way in there, and they're no less treatable than physical compulsions. It's just that I think a lot of times they can be sneakier and harder to nail down if you don't have the insight.
Yeah,
So that's
definitely.
why building the insight is important.
And other than building insight, what
Mm.
else do you think has been really effective in helping you manage OCD?
So for me, I am very visual. So because my compulsions are mostly mental, biggest one I would say is rumination. I'm a huge ruminator. I have visual ways that I disengage from rumination, right? Because there's like the initial thought. So if we're talking about like, I don't know, did I say something horrible in this conversation and this person is now crying and I have no idea, right? So OCD poses that initial question of like, what if this happened? That's out of my
Mm,
control, but I can control whether or not I start a conversation. And so I will picture, I have a couple different things. I'll either use a non engagement strategy, or I will picture myself, I'm like driving down the highway and there's a billboard. I can notice the billboard and say, hey, that's a billboard, but I'm like, I'm going to keep driving down the highway because I have a destination. I don't have to pull off at this exit and examine the billboard right now. So I'll picture that. Or I like to have like I love hiking. Say I'm hiking and I'm on a walk and I see a really weird rock right in front of me. I don't have to pick it up. That I can if I want to, but I don't have to pick it up. Say it's like I'm trying to, I don't know, I'm trying to do a fast hike and this rock looks creepy and weird. I'm going to like pull out a microscope. I don't have to do that. So I'll just kind of, at one point a while back, I had like a symptom relapse. And that was my big thing was don't pick up the rock. Like I would have that OCD question pop in and I would think that. So visualizing it is helpful. I think it makes it more tangible because a lot of times with those mental, they feel almost, at least in my experience, they feel more slippery. So having something to visualize has been helpful, or even a filing cabinet, picturing a filing cabinet, right? Like I'm going to put that in my cabinet and I can come back to that question if I want to, but I'm not going to right now.
I love
It's
that.
kind of,
Yeah, it's really powerful actually, because
mm-hmm.
they say about, and I'll just ask you this question after, they say that medication can sometimes
Mm-hmm.
do this, but on like a more of a physical level, where
Mm-hmm.
a thought comes in your head and your brain almost like recognizes it. You sit on it for a second and then it floats away. And I guess
Mm-hmm.
that's really what you're trying to do with these visualizations, is to be like, right, I
Mm-hmm.
recognize the billboard sign. I recognize that my brain has just told me that if I pick up this knife, I might stab my
Mm-hmm.
partner.
Mm-hmm.
But I'm going to choose to actually ignore that. And
Right.
and if you ignore something enough, it
Yeah.
will disappear.
Mm-hmm.
Obviously, that takes a lot of time and
It
strength.
does. It really
Um,
does. Yeah.
and I guess just not interacting with your thoughts. That is
Mm-hmm.
like the key
Yep.
thing for you to do. But that takes time, and it's interesting. I'm doing a meditation course next week. I'm hoping it will change my
Oh,
life.
nice.
But
Yeah.
that's kind of what meditation's all about as well. It's
Mm-hmm.
about being present and aware, but then coming
Mm-hmm.
back to your breath and coming back to being present. And we can get so
Yeah.
stuck in life, whether that be from with mental health issue thoughts, or just with just daily
Right.
general stresses,
Right. Right.
that we
Mm-hmm.
really forget to just be here right now. And
Right.
I mean, honestly, I have spent days and days ruminating on health anxiety thoughts. I don't want to know how much of my life has been lost to
Mm.
convincing myself I have cancer, or I'm having a stroke, and all these things. And
Yeah.
it's definitely took a long time for me to get to this point, but I am very much able to kind of have that process where I'm like, this is just a thought. That is all it
Yeah.
is. They are
Yeah.
just
Oh, that's
thoughts.
awesome. Yeah.
Yeah, and it doesn't, we don't need to sit here and think about it. If I'm dying, I'll find out if I'm dying. And that's
It's
not
true.
easy
That's
for
true.
someone with health anxiety to, and obviously someone else who has health OCD themes, that's really
Yeah.
hard to be able to tell yourself,
It's really hard.
but it's possible to be able to
Oh,
get to that
definitely.
place. And I think,
Well, yeah.
sorry, go on.
No, keep going. Keep going. Keep
No,
going.
no,
You're
I'm
fine.
finished actually. Finished.
Oh, no, I didn't want to interrupt you. I was just gonna to go off of that. Like OCD, it can't exist in the present. It can't. So if you're really grounded in the present, it doesn't really have a leg to stand on because these what if questions are not relevant to the
Face
present
to now,
moment at
yeah.
all. Like it'll use like technically valid logic. Like my junior year of college, I was convinced I had leukemia. I was like researching, panicking all the time. I bruise easily. Like my skin is literally like blending into my white t-shirt right now. Like I'm very pale. People always ask, they're like, "Are you a member of the Cullen family?" Because it's a whole thing.
Yeah.
But OCD, it is a fact that people with leukemia, they sometimes, like, one of the signs can be that they start bruising.
Yeah.
You're like, yeah. So
Yeah.
for me, it's like, I have a bruise. OCD is like, well, technically speaking, people with leukemia also have bruises. that logic is true. And so that's what makes it so easy
Yeah,
to latch onto the obsessions, because there is technically,
there is logic behind it. Exactly.
there's logic
Yeah.
behind it. And so it makes it so easy to really get like lost in that spiral, because it
It's
uses
the
logic to take you out of
uncertainty,
the present.
right?
Oh yeah. Oh
It's the
yeah.
like, we can never be
Mm-hmm.
100% certain that
Nope.
that bruise isn't leukemia in this very moment in
Nope.
time until we
Mm-mm.
go to the doctors and they tell us that it's not.
Yeah.
And
Right. I
Reese,
wouldn't do that if I were us.
no,
Go to
don't
the
do that.
doctor every time you have a bruise.
Um, I came to Australia actually, and
Mm-hmm.
skin cancer everywhere. There's
Oh
skin cancer
yeah.
clinics everywhere. And
Mm,
change for me is probably one of the biggest triggers for OCD,
yeah.
like
Yeah.
stressful change, life changes.
Mm-hmm.
So moving to the other side of the world was probably the biggest, no, not probably, was the biggest life change I've ever
That's
made in my
huge.
life. And
Huge.
I was fine, and then I wasn't fine, and like
Yeah.
I just became obsessed with every single mole on my body. And there was this
Mm,
one particular mole, and my mum was like, Emily, it's been the same your whole life. This mole has been the same. And I was like,
yeah.
no, but it's getting bigger. Like, it's getting bigger. And I'd be
You never
every
know.
single day, not even every day actually,
Yeah.
like literally every single possibility, like every single chance that I could get to look at the mole, I would look at the mole. I'd be taking
That
pictures
I
of the mole.
forgot I did the same thing. I like forgot
Yeah.
you're saying these things. And I'm like, oh hey, yeah.
Yeah. And I
Yeah.
was
Yeah.
fully convinced, right?
Mm-hmm.
So I thought, well, this is it. I've got skin cancer. I'm going to
Mm-hmm.
be a 27-year-old with melanoma. This, like, I'm dying. What am I going to do? I don't even have
Mm-hmm.
Medicare insurance and all this, right? So I went to a
Mm-hmm.
skin cancer clinic, and I went to go and get these moles checked. I
Mm-hmm.
obviously honed in on this one mole on my
Right.
arm.
Right.
So they will obviously, they don't know me and they haven't seen this mole before. So all I'm saying is that I think the mole's changed, which technically is a problem. And it
Yeah.
did look, what's the word, abnormal under the microscope.
Mm-hmm.
So I spent the next week between then and the next appointment convincing myself,
Mm-hmm.
oh no, sorry, then I went then the doc then he said, I want you to come in for a second opinion because I think it's fine but I'm not 100% sure. Well,
Oh,
I want 100%
yeah.
sure. So I said to him, well, can you tell me that I don't have cancer? And he was like, I'm pretty sure that you don't, but I can't be 100% certain.
Yeah.
Well, no, my brain doesn't work like that. So then I
Yeah.
go home, barely slept, went in the next day. They
Mm.
removed the mole
Okay.
and they were like, I think it's fine, but it is abnormal. And
Okay.
so I'm literally planning my funeral for the next. I mean,
Yeah.
this was probably, it was like the
Sure.
biggest scare I think I've ever had. Is
Yeah.
I, but
Yeah.
I have, I scare myself and it's usually nothing. And I was like, wait, what if
Yeah.
it is
Right.
actually real? Anyway,
Never
long story
know.
short, I don't have skin cancer, and so it's
Yeah.
just, it's crazy how, and that took about, honestly, about a month of my life. I believe
Yeah.
wasted, genuinely wasted
Mm.
on
Mm.
uh on just this, yeah, this obsession of, and it just wasn't
I had
anything.
a I had a mole like that. I actually went as far to, and this it's tough, but I went as far as I didn't want to get it checked out. It's scary, right? So there's the avoidance of the doctor, which the doctor would have
Yeah.
been reassurance, but then there's also, so it's like a Russian nesting doll situation of just compulsions. But I actually tried to scratch a mole off once because I was so
Wow.
convinced
That it was.
um, that it
Yeah.
was, yeah, and still alive, still kicking, not
Still here,
worried about it
and
now.
it
But like
wasn't
we're
skin
here,
cancer. Yeah.
mole's still there. Fun fact: you can't scratch off your own moles. Like what was going on? But it's wild how real the story feels when you buy into it. And
Yeah.
when you keep having the conversation, like the more you have the conversation with OCD and try to answer its questions, the realer it feels because you just get more and more invested. So that's yeah, it's wild.
It's very wild. I'm glad we could share some health OCD
I
stories.
know, yeah, we kind
Been
of
a
did a
lot of
little
those
sidebar
anyway.
there.
I would be here for hours.
Me
Anyway,
too.
um, So, in terms of treating OCD for
Hmm.
your clients,
Yeah.
what sort of strategies do you use and what do you think is the most effective?
So I mean, it depends. It can depend on the person. I've recently started using ICBT a little bit, depending on the person. Generally, I've been the most thoroughly trained in ERP. That's what I've been doing for ages. But now I'm starting to learn more about ICBT, gotten some training, continuing to seek training, and I've found that it can be really helpful as well. In terms of harm OCD specifically, I think honestly, the first thing that I do with any client is motivational work on like, okay, why are we doing this? Because the treatment is challenging and hard, but then also destigmatizing it as much as I can, because I think the shame factor, anyone who deals with taboo thoughts, whether it's POCD, sexual orientation OCD, harm OCD, there's going to be this shame. Am I a freak? Like, am I a horrible person? Is this therapist going to call the police on me? Because there
Mm,
are therapists who do that because they don't know and they're
don't
not
understand.
informed,
Yeah.
which is a problem. But so I really try to normalize
Yeah.
as much as I can
Experience.
before I even start um, diving into whatever approach we start taking. Um,
Yeah.
so I do that, and then also I think values work is really important. Obviously, like ERP, I all of the things there, but I think with these things specifically, they're so isolating, and there's this not more extreme pain, right? Like any OCD is brutal, but when you're having these like specifically like gruesome, horrific things pop into your head, and you're questioning like sometimes even like your humanity and just everything about yourself and what you care
Yeah.
about, like being able to feel confident in your values and have compassion for yourself is like really a cornerstone, I think, of the treatment there. Because without self-compassion, if we are focused on shame, shame really, all it does is create a barrier for any kind of problem solving.
Mm,
So if we're compassionate and we understand what our values are and we feel firm in our values, and then we partner that with destigmatizing these intrusive thoughts and these themes, like then that person is going to feel more comfortable starting to face the fears because they feel confident in themselves and they're being kind to themselves, and they trust me too. Because
yeah.
if there's no trust, I think that specifically with ERP, exposures are so scary. And these themes, any theme is really vulnerable, but these themes are really vulnerable. You know, like I said, that person got kicked out of their dorm, people have had the police called them, like it's a whole thing. And so that trust is really important too. And going into a scary treatment like ERP, if you don't have that trust there and you don't have that compassionate approach, it's not going to be as effective because the person isn't going to be as open, because they're more driven by shame than they are by anything else if they feel that that shame is um, rightful. So it's
Yeah.
kind of
No.
uprooting that. Yeah.
I can really understand that, especially the trust, like you
Mm-hmm.
said, if they've been kicked out of their dorms at university
Yeah.
or school. I mean, it's ridiculous.
Yep.
Or maybe they've told a friend or a family and they've completely disowned them or whatever.
Yep.
Um, that must be so difficult, but so brave of the person to be able to then seek
Oh
support
yeah.
after
Oh
that.
yeah.
So,
Mm-hmm.
wow, that is incredible and truly admirable for someone to be
Yeah.
able
And
to
I
do that.
say that every time. Yeah.
So, just quickly, what would ERP look like for somebody who's experiencing harm OCD?
Depends. It depends on the types of thoughts. It depends on what's happening for them. Because first off, I exposures needs to be, they need to be values based and they need to be consensual. So when we do ERP, if we're doing, you know, exposures that are really scary to that person, those conversations of is this a values-based exposure? Are you really willing, or are you feeling like you're being forced into this exposure? That conversation has to happen. But for someone who, I'll use like my thoughts as an example, it could be reading news stories about someone who was totally fine and then snapped and stabbed her husband, right? Like reading a news story about it. Depending on the severity of the what's the, not severity of compulsions, but the how impaired someone is, like they may not be able to hold a knife, right? So it could be holding a knife, but there may be more extreme exposures. And whether or not those are needed are dependent on the person. And it has to do more with like gestures that could potentially imply harm. So like standing in front of someone and being like, I might hit you, or something like that. And those exposures would be done with a trained clinician
Yeah, I was just wondering,
who
are
knew
these
what they were doing.
supervised or are these just,
Supervised, yeah. So those are
yeah,
always supervised exposures, and they are done with a trained clinician. Not everyone needs those. Some people are like, yeah, I'm not doing that, so we find something else, right? But I would say always starting with what you avoid, regardless. Whether or not you do like extreme exposures for harm OCD or not, looking at what you avoid. So for some people, it's like, yeah, no, I don't empty the dishwasher anymore. An exposure for that person could literally just be emptying the dishwasher.
yeah,
And if they have intrusive thoughts while they're emptying the dishwasher, being like, interesting. Yeah, that's technically a possibility for me, and not engaging in it further. It
yeah,
could be making, like I said, making a salad. It could be having a conversation with someone around a topic that they tend to avoid because they're worried about blurting something,
yeah.
right? There's so many, always start with what you avoid if you're thinking about it on your own.
And are there any specific resources
Mm-hmm.
or like support networks? Obviously, you have a page. I'll tag it in here, and I know you do some
Mm-hmm.
great educational pieces and stuff around
Mm-hmm.
different themes of OCD, including harm OCD. But for harm
Mm-hmm.
OCD in particular, is there anything that
Yeah.
you think would be beneficial for somebody who's listening, who might be struggling, or maybe got a friend who's struggling?
Mm. So I think that there are a lot of the pages that I honestly that are there are so many therapists on Instagram who focus on taboo themes like that. So there's like Taboo Tracy. I think she literally, that's all she talks about is taboo themes.
I love
I
that.
would say, I know, I love it. I love it. I think that a thing that's really great and can be really helpful for people, particularly with people who feel isolated, is seeking out like support groups. Um, those can be really, really helpful because it's all the normalizing piece, right? Because I think that these thoughts that are taboo are not insanely uncommon, right? It's not like, oh,
Mm,
no one experiences that. People without OCD, that's like so. It may, I think that a lot of people, they don't talk about it as much, but I think finding support groups that really foster openness and um, and non-judgment is really helpful for people, because hearing from other people who are going through it can help um, with the isolation piece, because I think isolation and shame are huge for harm OCD specifically. And so if you're able to find um, like I said, a support group, or if you're able to find, even like there are communities online that people can find through like therapists who do courses. um,
amazing.
yeah, that too. I think community is a big piece for that, and also like therapists that specializes in OCD, not a therapist who doesn't specialize in OCD. I would
Yeah. And
shout
I
that
also
one
think,
out too.
yeah, and I also think finding a therapist like yourself who has experienced it. I'm not saying that
Mm,
that's an absolute must, um,
yeah.
but I think I would like that because I know that they're really, especially when it comes to harm OCD.
Mm,
Maybe not every therapist will be open about dealing with like experiencing harm
mm-hmm.
OCD, but at least if you know that they've experienced OCD, they will have that non-judgmental attitude. And look, all
Oh yeah.
therapists, clinicians, psychologists, whoever it is that you're dealing with,
Right.
should have a non-judgmental attitude.
They
Otherwise, they
should.
definitely should
They
not
should.
be doing that job. Um,
Ooh yeah.
Interesting how much I've
Mm-hmm.
seen that when I have done work experience in the
Yeah.
past. And there's a
Mm-hmm.
lot of people in these services who should not be there, in my opinion. But anyway, that's a story for another
Agreed.
day.
Strongly agree with that one. Yep.
Sorry for another day. But yeah, so yeah, that's really helpful advice, and I will
Yeah.
leave the link for Taboo Tracy. Never heard of her actually. Should give her a follow.
She's so fun. Yeah.
And also I probably do follow her. I follow so many different pages, and I'll also leave a link to your Instagram. But before we leave and you start getting ready
Mm-hmm.
for bed, um, what advice would you give to someone who suspects they might have OCD and
Mm,
is struggling with these intrusive thoughts and fears?
yeah. I would say finding specialized treatment, but even beyond that, if you're struggling with this, emphasizing self compassion and being kind to yourself, regardless of these thoughts, knowing that you're not your thoughts, knowing that OCD is a bully and we do not need two bullies in the picture here, is what I always
That's
tell
really
people,
great.
because it's so easy to see your thoughts as a reflection of yourself. And so if you need to write it down every day that you're not your thoughts, if you need to look in the mirror and say it and say I am not my thoughts, whatever you need to do to really get that message to sink in, because without self-compassion, it's what are we going to do, right? And
Mm.
without knowing who we are and knowing having trust in ourselves. The trust in yourself piece comes with time, but at the very least, as you're uncovering these things, as you're learning about intrusive thoughts, as you're dealing with intrusive thoughts, just being grounded in kindness and self-compassion. That's honestly the biggest thing I would say to someone dealing with these, because shame is just, it's not going to help. Being cruel to yourself is not going to help. It's just going to it's going to make you feel way worse. And
Yeah.
the what you say to yourself from those things, if you're speaking to yourself through those lenses, it's not true. So just remembering to be kind throughout the whole process, I would say, is my biggest piece of
I love
advice.
that.
Yeah.
And I think that self-compassion has been a really reoccurring theme
Mm-hmm.
throughout this episode.
Yeah.
And I think one point to mention, if you have got this far, is if you are
Yeah.
listening, you aren't struggling with Harm OCD, but you're listening because you're interested to learn, please be compassionate towards others who might be struggling.
Yes. Yes.
That's equally as important as the
Mm-hmm.
self-compassion. If you're struggling with it, please, if you're listening and you've listened to understand because you have a friend or family member that you think might be struggling with this, or because you just want to educate yourself, be
Mm-hmm.
compassionate. Be that person that looks at something on Instagram like this, or sees a thing on TikTok, or sees something on
Mm-hmm.
in the news headlines, I don't know, and instead of going straight to stigmatization and
Mm-hmm.
you know pre-programmed beliefs about what that might be about this person, research, educate yourself, and be compassionate, because that is how we are going to make change in the world of mental health. It's not about understanding it all. It's not about really being able to put yourself into that person's shoes, but it's about just being educated and trying. That's all you can ask, is for someone to at least just try to
Yeah.
understand Harm OCD, or any of these taboo mental health issues. But thank you so much for talking
Yeah.
about this today, and for being so
Of
open.
course.
Um, Keep doing what you're doing. You're doing amazing work.
Thank
And
you.
I will definitely share, obviously, all your links as well. And yeah, I just really appreciate your time. And I hope you've enjoyed having this chat.
I appreciate you having me. It's like always such a breath of fresh air when people are
Open
up
to,
for
yeah,
anything that destigmatizes this. So I really
yeah.
appreciate it for sure.
Thank
Yeah.
you so much. And enjoy the
Awesome.
rest of your evening.
Thank you. Thank you. Thank you.